Assalamu alaikum. Now, now I would like to talk about some respiratory problems. Start with this A R D S. What does ARDS stands for? ARDS stands for acute respiratory distress syndrome. In here there is a criteria called Berlin criteria, but apart from remembering those criteria via textbook knowledge, you can easily remember via mnemonic, that is abnormal chest x-ray. First, abnormal chest x-ray. What does it stands for? There is bilateral lung opacity. Bilateral lung opacity. Then RR, that means respiratory rate should be more than 30. And there is another thing, that is a respiratory failure within 1 week of alveolar insult. Within 1 week of alveolar insult. Then the third point is decrease PaO2 or decrease PaO2 or FiO2. Partial pressure of oxygen, and this is measured by ABG. So for diagnosing ARDS, first we have to do X-ray. Before he has some sort of clinical feature like sudden severe shortness of breath, maybe associated with chest pain, and then he comes to you, then you will get bilateral lung opacity, and you do EBG. After doing EBG, suppose patient is getting near about patient is give patient's FI PaO2 is near about 48, and his FiO2, if he is not having any oxygen, so FiO2 is 21%, that means 0.2%. So it is approximately near about below 300. So PaO2 FiO2 ratio is below 300. And the last S stands for symptoms of respiratory failure not due to cardiac causes or volume overload. Not due to cardiac causes or volume overload. So if these four criteria meets, then you can easily say that the person has ARDS. That means acute respiratory distress syndrome. And what other things you wanna do in ARDS? In ARDS, the consequence would be the impaired gas sections, decreased lung compliance. There is impaired gas exchange. The consequence impaired gas exchange, decreased lung compliance, and there may be pulmonary hypertension. This is high yield, that ARDS can comes with pulmonary hypertension as a consequence. So what should be the management? The management of the ARDS is why this is happened. That means you have to look for the cause. You have to look for the past. The mnemonic is past. That means pancreatitis, aspiration, pancreatitis, aspiration, sepsis, trauma. Pancreatitis, aspiration, sepsis, and trauma. There are other cause. That means they have bad past. That means burn and drowning. Burn and drowning. So pancreatitis, pancreatitis, aspiration, sepsis, trauma, and there may be burn and drowning. These are the cause of mm, ARDS. So in ARDS, the treatment would be treatment of the underlying cause, like treatment of the pancreatitis and other things. If the patient is in the mechanical ventilation, you have to decrease tidal volume, you have to decrease tidal volume, you have to increase peak 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 expert positive and airway pressure. You have to increase the PEEP to keep the alveoli open during expiration. You have to increase the PEEP to keep the alveoli open during expiration. And the severity of the hypoxemia is being calculated by PaO2 or FiO2. The number is calculated by arterial blood gas measurement divided by the fraction of the inspired oxygen, FiO2, expressed as a fraction. Like a patient PaO2 is 10 kPa or 75 millimeter of mercury on 50% oxygen, 75 millimeter of oxygen on 50% oxygen. So his FiO2 is zero point 0.5. So his PaO2 by FiO2 is ratio is 20 kPa or 20 his PaO2 ratio is 20 kPa. These would be denoted as moderately severe ARDS. Moderately severe ARDS because uh, mild ARDS is 300 to 200, mild ARDS. So uh, below 300 is always ARDS. Is if it is below 300 to 200, then it is mild. If it is 200 to 100, it is moderate, and if it is less than 100, that it is severe. And that is all about ARDS. Hope you enjoyed my video about ARDS. Inshallah, you will be benefited.